The experience at Emirates Specialty Hospital has been outstanding from the moment I checked in until today. I'm 2 days post-op. The nursing staff have been amazing. Dr. Paul was amazing, and all the team in the operation room was also amazing. I'm Lynn Hathaway. I'm from Northern Ireland. I lived in Dubai for the last 18 years, and I am 2 days since my left total hip replacement. I decided to have a hip replacement because I've suffered with terrible hips for the past few years. It's a genetic issue within the family. My family, many of them have had hip replacements, so I knew it was something that I would have to get looked at. Then that's when I found out about Dr. Paul Jairaj. He came highly recommended by a friend's physio as the best doctor to see with regards to hip problems in Dubai. We discussed many different possibilities with my hips, but the best way to move forward for myself was to have a total hip replacement. With regards to that, Dr. Paul then took my CT scan images and made a 3D plan for my own hip. So the hip that I was given is made for my own body. It is not a standard hip. Dr. Paul made this hip for myself.
I'm Dr. Paul Jairaj. I'm a consultant orthopedic hip surgeon at Emirates Specialty Hospital. I'm going to give you a story about a patient that presented to me a few months ago. She was referred by her physiotherapist with left hip pain. She had had treatment for quite some time, unfortunately not being able to make the recovery she was hoping for. We arranged investigations for her which showed she had severe hip arthritis as a consequence of a childhood hip problem. We arranged imaging which included a 3D CT scan. This allows us to match an implant to fit the patient exactly, especially important given her young age and activity levels, where standard hip replacement surgery is not necessarily going to give an exact fit for her to allow her to have a fast recovery and return to activity. Surgery is very straightforward. It's a posterior approach hip replacement where we follow this 3D plan in the operation, and it allows us to place the implants very accurately. Surgery is very quick, takes about an hour and 15 minutes. It's very easy when we have these 3D plans. So this is Lynn's imaging. We have a pelvic view. You can see her right hip and her left hip, and you can obviously see an implant here on the left-hand side. What's interesting, she already has quite significant arthritis in her right hip because the space between the ball and the socket's been reduced down. So already her right hip's quite arthritic. Her left hip looked the same. We do a 3D CT scan which allows us to match an implant to fit her. So we have a whole series of implants which are designed to fit. So I have a 3D computer plan which is matching an implant to fit her. So what we see here is a cup component and a stem component. There's a ceramic ball and liner in here, which is the articulation. That's got the lowest friction known to man, so therefore these last a very long time. You can see how it just fits exactly down the stem. So that's our custom fit with this implant. These implants last approximately 20 plus years in 95+% of patients. They are one of the best performing implants currently in Europe.
I feel fantastic after the surgery. It's been very surprising how great I felt. I was very scared, obviously, to have to get up and walk on a brand new hip. When I came into the hospital for surgery on Wednesday morning, I was hitting a pain of 8 to 9 out of a scale of 10. When I was asked to walk after the surgery, I was obviously very scared. When I got up, I haven't had pain above a scale of 3. I've only been taking Panadol and naproxen as painkillers. I've not had to have anything stronger. So after the surgery, they brought me down to my room from the recovery room, and that evening I was able to get up on a Zimmer frame and walk around my room. The next morning, I was then able to get up and walk with crutches and was able to do 3 stairs as well.